going to be hard.
That was you all in the shot.
All right, here. The sphenoid sinus is here. The vestibule is just this area that enters the nose.
Okay.
Superior, middle, and inferior nasal concha. Concha? How do you pronounce that? Concha?
Concha. Concha is
Can we move this down? So
Yeah.
that I can
Miati, that's another name. Miatos. Different schools.
Anterior nares is the opening. And then the posterior nares is this area in the back.
Posterior nares is right, yeah, where you point, right in here, at the level of a nose, okay?
Are you taking a video?
This is the level of a nose.
Okay, you can talk now.
Nasopharynx is where the nose.
So that orange thing?
No, that's a gland. It's just the area. It's kind of hard to
Where the arrow
point
is
at. It's like
pointing.
it's just the back where the nose is starting to go. Oropharynx, so the mouth comes in, so the oropharynx would be this area. And
Look
then
at the level and just continue.
like where it is,
towards-
like the nose, oro,
Right,
so
right.
naso,
It will
oro.
Take you to the area.
And then the laryngopharynx is like here.
Laryngopharynx is at the level of larynx.
And then trachea. Or no,
But
trachea.
make sure, hang on. I'm sorry. This is larynx, right? This is epiglottis. So laryngeal, this is mouth, right? Below, just this region, right here. Just the region, right here, opening. That's a laryngopharynx. Yeah.
And then trachea is not visual on here, right?
From here and down,
It's
from
not-
here down, that's esophagus. That's esophagus starts. Okay, so right before esophagus, below mouth. So this really small region right here.
And then for trachea, do you want me to do it on this one?
Trachea,
'Cause
there's
it's
no
not really-
trachea. Trachea, which should be below.
Right, so there's other
So,
models, so I'll
yeah.
do it on a different one.
Yeah, you can use that.
Yeah.
model.
That's it for that. Thyroid cartilage is here.
Large cartilage.
Cricoid cartilage is here. The tracheal cartilage is here. And then the cornicula and arytenoid, we're not doing, right?
We excluded.
Okay, so cross those two off. Epiglottis. And then the vocal folds are the folds in there.
The white part.
The white
Yep,
part.
Yep.
Let's see the white part here.
Yeah, right here. The folds.
Okay.
Down. This way. Okay, so trachea. Here, do you want me to pick it up?
Making my student nervous.
All right, trachea. There's right and left primary bronchi. So it's the first branches off of the trachea, right and left primary bronchi. And then the secondary bronchi are going to be the branches that branch off of that. So secondary are all here. And then the tertiary are
Over there.
the ones that branch off from there.
Yeah, they'll mix with the vessels, though, those arteries and, kind of grayish veins. Like, it's supposed to be blue. I don't know why they...
The right lobe
No.
has 3. So it's superior, middle, and inferior.
Do that one more time, please.
Superior, middle, and inferior lobes of the right lung. And if there's like a sticker in the middle, or I guess it wouldn't matter because that's the middle, but for the top or the bottom, just look where the diaphragm is, and remember that's always
Pointing down.
right. And then the left lobe just has 2, and it's the superior and inferior lobe of the left lung.
So we have to write that of the left lung,
Yeah.
of the right lung.
Yeah. And then the pulmonary veins and arteries are the red and I guess it would be gray, right? The red and gray.
What's that?
The red and the gray.
Yeah, those are arteries and veins.
And remember,
Veins
it's
are gray.
opposite in the pulmonary system. So the red would be venule and the gray would be arterial.
I mean, blood will be different.
Right.
But the vessels will be the same.
Right, but color-wise, wouldn't it be
Right,
opposite?
right, right.
Okay.
Right. Yeah, veins, actually, we call veins, but they carry arterial blood, and we have arteries, but they carry
All right,
veins.
respiratory bronchial is here.
Number 1.
The alveolar sac is the outside of it, so it would be like here. The alveoli is each individual thing is an alveoli. And then the alveolar duct, there's only one part on this that shows it, and it's just here, where it's cut. Yep, alveolar duct.
Yeah, it's exposed alveolar duct.
And then pulmonary, the venules and arterioles.
Which one is which?
They're different in color.
Right, so
Opposite.
venules, arterial.
So for this test, we know that the veins are red, the
Right.
arterial is blue.
Yep,
Right.
exactly.
The
So
arteries.
it's the opposite.
Veins
In
red.
lungs, always opposite, guys. Always think logically.
What is
What
it?
blood reach lungs?
The arteries.
Venous blood for reoxygenation. So what type of vessels bring blood to the organs? Arteries. So you can call arteries, but actually it's a venous blood in arteries reach the lungs and opposite.
All right, parotid gland, submandibular gland, and then tongue.
One more time, please.
Parotid gland, submandibular gland, and just sub under the mandible, and then tongue.
There's no sublingual gland?
Yeah, here, but it's not on their word bank.
Not really?
Yeah,
Okay.
you want me to write it on there?
No. No.
That's fine.
Sorry, Dr.
But this is the sublingual gland, and sublingual under the tongue, submandibular under the mandible.
It's probably, we didn't have that model, that's why we didn't include
Yeah,
that. Now
probably.
we have it, that's
'Cause that
fine.
one doesn't
But
have
that's
it.
fine.
All right,
It's very
esophagus
easy.
is here.
Say that again.
Esophagus.
Okay.
All right, the cardia region is just the region around the cardiac sphincter or the lower esophageal sphincter. Do they need to know both or just one?
Say it again,
For the
I'm sorry.
sphincters? Do you want them to know the cardia and the lower?
Mm-hmm.
Okay.
Yes.
And it
Both
would,
names.
the sphincter is here.
It's a
So
valve, I
cardia
told you.
and lower esophageal. Right here.
And remember, it's called cardia because nearby heart, that's why.
The
Okay,
cardia
it's
region
next
is
to
just
it.
this region. The fundus is this region. The body is here.
Mid region. Yeah.
And the pylorus is here. And the pylorus is near the pyloric sphincter.
So that whole back side or this whole area right there is the
Here?
fundus?
The fundus would be here.
Okay.
Can you turn it that
The
way and show
large
us the
white,
fundus?
white part.
So,
White part of the...
Cardia,
Right.
fundus, body, pylorus.
Got it.
One more time.
Large one.
Cardia, fundus, body, pylorus.
Thank you.
Regions, you're welcome. And then the sphincters are the openings. The rugae is inside, and those are the folds inside of the stomach. So rugae. And then the greater curvature would be this curve, and the lesser would be here. And obviously this is smaller than the other ones.
How about those muscles on the stomach? Oh, okay. Oh, you use that one?
Yep. That's the only one that I think really shows it really
How
good.
about the-
Well, I guess like it does, but this one's better because
Yeah,
it cuts it
this
off.
is more visible.
Okay, so serosa is just the outer lining around the stomach, so it would be like here. And then the longitudinal layer is this one.
We're talking about muscles, guys.
The muscle layer?
In
So it's longitudinal.
Yeah,
muscle layer,
in the stomach, there's three muscles being
Circular.
run differently.
muscle layer, and that's circling around the stomach. And
Can you
then-
point to the circular again?
Yep, right here. And it's circling around. And then oblique muscle layer of the stomach.
You need to look at the fibers, how they run. Okay, if they run
The
across
oblique
like
is.
Oblique is like
transversely,
diagonal.
Yeah,
Okay.
oblique
Longitudinal is
diagonally, and
this way, and then circular is
longitudinal,
around.
Find the length and just along the length of the structure. Okay, 3 layers of a muscle.
Okay, for the duodenum, do I just do it on this one then? Because it's not really on this.
you
But
can-
what about this new one?
Okay. Let's see. Yeah, this is the duodenum right here. It starts and ends up in here.
Right, okay. So I'll show them on both of them then,
Yeah, you can use either one.
just so that.
Kind of better, but better quality, I would say.
Yeah. Okay, so the duodenum is here.
When you finish, can you show it on this side too?
Yep. The jejunum and ileum you guys can cross off because it's just an area of the intestines. It's not really, it's kind of hard to label it, so those can be crossed off. The cecum is here. And then the ileocecal valve is here.
So it's where small intestine gets into the large intestine, that point or joint point. Okay, there's a valve. It's called ileocecal valve. Okay,
Ascending colon. And then this is transverse colon. And then descending colon.
there's no sigmoid on the list.
Don't forget about us on this stuff.
I won't. The sigmoid is here. So the same on this. It's going to be cecum, ileocecal valve, ascending, transverse, and descending colon. And then sigmoid, kind of like an S.
It's on the back.
Yep. And then the rectum is the
The
bottom
rest.
portion, which is,
Straight portion, which is not visible.
yeah,
remove
this one
that.
is better.
Yeah, this is
Rectum.
rectum.
So rectum would be.
Portion of a rectum. There's rectum, up to here. So from here, so right up to here. It's an anus right here.
All right, I'll do this over here now for you guys. Okay, so the duodenum.
Can you like put your hand on top of it because you're covering it when you tell us?
Well, it's here.
Number 24.
Okay. And then cecum, ileocecal valve, ascending colon, transverse colon, which is here, descending colon, and then I showed you the sigmoid and then rectum.
There's no like pancreatic gland or something like that?
Yeah. You keep jumping ahead to different.
Oh, yeah? Okay, sorry.
Yeah, I think it's the next one.
Just curious.
Yep, it's the lobes of the liver, which is just right lobe, left lobe, and gallbladder. The quadrate and caudate you guys can cross off as well.
I'm sorry, which one?
The quadrate and caudate lobes you can cross off. Where's my liver? Oh, well, I'll just do this one. So the right lobe is here, and the left lobe is here. And then the
There's a
gallbladder is
fish.
the green.
There's a fissure. See that? The white.
Separates
yeah.
it.
It's a border between lobes, the left and the right one. So right lobe larger than the left.
All right, I'll do this one first. Okay, so again, the duodenum is also on here. And then the pancreas. The right and left hepatic ducts. So right, left hepatic duct.
You're green?
Yep, the cystic duct is the duct that comes off of the gallbladder. So here's cystic duct.
Can you just turn it over?
Yep. Right and left hepatic duct, cystic duct, and then the common bile duct is here. The pancreatic duct is the one that runs through the pancreas. And then the major duodenum papilla is this one here. So major is on bottom, minor duodenal
William
papilla is
can't
on top.
No, I'm okay. She's doing it on
Oh,
my phone, so.
yeah, just turn.
Do you want me to go through everything
Yeah.
again?
Yeah, one more time.
All right. Right and left hepatic
Take it
I
duct,
think those guys.
cystic duct, common bile duct, pancreatic duct, major duodenal papilla, minor duodenal papilla.
The major's down here?
Yep.
Okay.
And it should say on your, yep, it does. So it's telling you it's
Right.
where the common bile and the pancreatic join.
Okay.
That's it.
Okay. Oh, we're not doing the urinary system?
Nope.
Yeah, and
Perfect.
that's since they're
Thank
looking
God.
at that, we just tell them that this is a spleen. Because they
This
look
is?
at,
Yes, yeah.
look at.
And it would be the same on here, you guys. So the pancreatic duct is on here as well. The right and left hepatic, the cystic, the common bile, major, minor.
I'm sorry. Go over that section
Yeah.
one more time.
Gallbladder. Right and left hepatics are here, the green. Cystic, common bile, pancreatic duct, and then it's kind of inside. Let me take this off. See better. The major duodenal papilla is here, and the minor is here.
So the minor
Are
is
you going
white.
to use this one for?
Yeah, I
Okay,
can
go
use
over
this
that
one or
for
this
us
one.
on this side now.
Either or.
Do you want? Okay, hold on. Let me go on
Can
this
you?
side.
So this is the major? Or this is,
Yes,
and then this is the
Gallbladder,
minor?
Minor.
right and left,
look at
hepatic
side
ducts,
difference, even
You can
cystic
see
duct,
it, yeah.
common bile duct, pancreatic duct,
slightly should be
major
larger,
duodenal
wider.
papilla,
Than that
minor
one, right.
duodenal papilla.
It is.
Papillae, papilla,
Yeah,
papillae.
Major is larger.
A at the end.